The Barton ceiling track system allows caregivers to transfer and reposition patients safely and effortlessly, with the use of a full-body repositioning sling. Log roll the patient to place the sling, or when possible, preload the bed with the sling prior to patient admission. To activate the lift, push the power button located on the upper left-hand corner. The RTC button to the right returns the lift to its charging station when pressed and held for approximately 3 seconds. To raise and lower the carry bar, press the up or down arrow buttons. Press the left or right arrow buttons to move the lift laterally. When it's time to reposition the patient, the ceiling lift is brought into position and the carry bar is oriented with the length of the patient. The lifting straps on one side of the sling are attached to the receiving hooks on the carry bar. Before repositioning, adjust the patient's pillow for comfort and ensure the side rails are up. During the lift process, the patient is raised and gently rolled to one side. While the patient is supported by the repositioning sling, pillows should be tucked into place, relieving potential pressure areas. The reverse process is used for turning the patient onto the opposite side. Once comfortably positioned, lower the carry bar and remove the lifting straps. Whenever the carry bar is at head level or lower, stabilize it with one hand to prevent swaying. Ensure there is no bunching or wrinkling of the sling by gently pulling and smoothing the surface, eliminating potential skin irritants. The repositioning sling can also be used to transfer the patient to the head of the bed. By connecting all lifting straps on both sides of the sling at the same time, the patient is lifted in a flat or supine position and can then be repositioned up in the bed. This is done by gently pulling the patient toward the head of the bed. Or, while one caregiver supports the patient, the other can reposition the bed itself, allowing proper placement. The repositioning sling can also be used for lateral transfers. Before transferring, make sure the bed and gurney are in close proximity with the brakes locked on both. Lift the patient approximately 4 to 6 inches off the bed. If the patient is secure and comfortable, proceed with the transfer. One caregiver supports the patient's head and prevents lines from catching or becoming tangled. The other guides the patient for proper positioning. Remember, we always gently pull and smooth the sling to prevent pressure areas. Similarly, the repositioning sling is used when transferring to and from a cardiac or bedside chair. The Barton ceiling lift and track is designed for years of reliable service. However, to ensure the lift is properly utilized and maintained, all caregivers should be aware of important safety features. When lit, the green indicator light on the exterior case of the lift shows power on. The yellow light just below indicates the motor is docked and charging. If illuminated, the bottom red diagnostics light indicates service is needed. When pulled, the red emergency stop cord cuts all power to the motor, preventing any further movement. To reactivate the lift, simply pull the cord a second time. Blue and white positioning arrows on the hand control coincide with the blue and white directional arrows on the ceiling lift unit. If for some reason the hand control is damaged during use or not responding, the emergency down button on the lift may be pressed. To ensure compatibility, always compare the weight of the patient with the weight capacity of the sling and lift.